centimeter of insertion onto the tibia. So there are four roots, two on either side, but commonly injured is the posterior ones. The root tear can be traumatic or degenerative. Traumatic is usually on the lateral posterior side and degenerative is usually on the medial posterior side. So once there is root tear, there is loss of hoop stress due to extrusion of meniscus and the contact pressure increases leading to early OE. On the lateral posterior root tear, if it is there, there will be grade 3 lachman and frank pivot shift. Now coming to repair, we have to do three things. First, we have to prepare the area where the root sits. That area of tibia has to be prepared. You can prepare the footprint with either a curette or a shaver without suction. The second part is making a drill hole through the tibia if you are using a transtibial technique. And the third is passing of sutures through the meniscus. Now, second technique is using a suture anchor, but the gold standard technique is transtibial technique. And in this technique, there are two ways to pass suture onto the meniscus. One is a luggage tag or lasso loop technique, and second is a simple suture passage. So we come to the example. Just click it. So that's the root tear on the lateral side with a radial part which is being excised. The meniscus is seen attached to the meniscofemoral, but the root is lifted off. So first step is prepare the footprint, which was done, and now we put a simple ACL guide there and passed a wire over which 4 mm drill will be passed. So this is a transtibial technique. Then we pass a luggage tag suture through the meniscus, and this is done away from the point of insertion in the first pass. And we try to take a bite not through the meniscocapsular junction, because that's a weak area. When you pull the suture, it can tear. We try to take a bite through the meniscus, but closer to the capsule. So after the bite is taken, a lasso loop is passed, and the video is running slow. So away from the insertion site, a lasso loop is passed, and closer to the insertion, a simple suture is passed. So this simple suture is utilized to pass a sliding knot, and this sliding knot is it just brings the meniscus snugly to the footprint, and the lasso loop thread just acts as a buttress to tie over the endo button. So after this is passed, second suture is being passed, which is closer to the insertion. Again, it will be drawn back through the tibia to out and tied over endo button. This is a very simple technique. The next is repair with the suture anchor. This is a medial root, posterior medial root tear, in which the root is torn and retracted to the medial side. So first the bite is taken from the posteromedial portal with a retrograde suture passing device. The wire is retrieved from the anterior portal and it is threaded, or it can be left as such, and a suture anchor is passed through the posteromedial portal. One of the wire is retrieved anteriorly, and through this shuttle wire, it is taken out to the posteromedial portal. The remaining two blue sutures are drawn into the anterior portal so that there is no entanglement of suture while passing the knot in the white suture. Now a sliding knot, SMC knot, is applied to the white suture, and you will see the meniscus getting back to its point of fixation. So similar steps is repeated on the blue suture. The blue suture is taken back through the posterior portal, and again retrograde device is used to pass suture and a knot is tied. This is the third example, but I won't go into that. We'll practice on to the model and the cadaver. Thank you.
और एंकर दोनों से रिपेयर कर सकते हैं रूट
दोनों से कर सकते हैं.
टनल बना के
टनल बनाओगे आप जब आप एंडो बटन यूज करोगे टिबिया पे. अगर आपको एंडो बटन नहीं बना रहे हो, ट्रांसटिबल नहीं कर रहे हो, तो आप सुचर एंकर से कर सकते.
So in the practice model, we'll use the transtibial suture technique, not the anchor. Ranjit?
If you cannot mobilize the root to the point to the root insertion meniscus.
If it is a chronic tear, you will find it difficult to mobilize it to the footprint. In that case, you can put it at the point where best it can be. You don't do a repair under tension because it will fail.